KUSI.
Welcome back. Nonprofit Just in Time for Foster Youth is working to ensure all local foster youth have access to the mental health resources they need. Here to tell us more about some of the services the organization offers is Director Jill Ault. Jill, thank you so much for being here.
Thank you. Nice to be here.
Our pleasure. Just in time. I love this. On Friday was World Mental Health Day. No better time to be discussing this, raising awareness for mental health, especially in our foster youth. And I'm glad we're talking about this because mental health hits differently for those in the foster youth compared to those who are not in foster youth.
Absolutely, it does. We serve, that transition age, young adult, kind of 18 to 27. And by virtue of the fact that they're in foster care, they have higher rates of childhood adversity. So higher rates of trauma, family separation, loss, instability. All of that's going to lead to greater rates of both physical and mental health issues as they get older.
Yeah, give us an idea of some of the services that are helping the clients of Just in Time for Foster Youth.
So I'm the Director of Mental Wellness, and so I'm responsible for all of our therapeutic services. So we do a lot of individual therapy. We also offer couples and family and group. So that's a big piece of what we're doing in terms of the mental health piece. Other forms of mental health that we're doing, we have more community-led spaces. One group that is leading, really working with the adversity by forming community together and helping healing community and help to mitigate some of those adverse childhood experiences.
I'm glad the stigma of talking about mental health is going away. You and I were discussing back in the 80s and 90s, it really wasn't talked about at the dinner table. And now it seems like it is more common for families and young adults to be discussing some challenges of mental health these days.
Absolutely. It's so much more normalized, which is great. Like you and I were talking, it's really, I think, a generational change. But one thing I find is that within our population, there's still more of a stigma. I think mental health has been negative for many of them. They were maybe forced into treatment when they were children. It's not as easy to want to go to therapy. So one thing that we've really tried to do through introducing therapeutic services is to destigmatize it for our community. And I think we've been really successful in that. People now, they talk about it. They're like, I'm going to therapy, and it's something that they really look forward to now.
Well, I'm glad we're talking about supporting those in the foster youth who are struggling with mental health, but also a lot of our viewers are at home who have a young adult and a teenager maybe struggling with mental health. This interview could be helping them as well. And I know we're focusing on the foster youth and a lot of your clients, but what advice do you have for families who are watching who need some help and some direction with their youth?
Yeah, that's a good question. It's hard to find therapy. So I think the first thing is if they see that they have a young person in their life who's struggling, really have a conversation, address it, be open. Not talking about it doesn't make it go away, right? So talk about it, see what the need is, and then start looking. It's hard to find a good therapist out there too. And that's one thing that we're really trying to remove that kind of a barrier.
And before we go, what are you learning as far as what are some of the struggles and challenges that our youth are facing right now that is causing some mental health struggles?
I mean, obviously, there's just a lot of stress in the world. There's so much instability, there's so much anxiety. With our population, there already is a lot of instability and anxiety, and I think there's more of that, just not knowing where their future is, what that's going to look like for people. That's a big piece.
Yeah, well, we appreciate you being here discussing mental health awareness amongst our foster youth and also helping some of their families who are watching who are going through it right now with their young adults and teens. Jill, thank you so much.
Thanks so much.